In this session, we're going to be addressing the matter of professionals. One of the unique features about healthcare organizations is the huge number, diversity types, if you will, of professionals that operate in our milieu. It's a unique feature of our organization, that is in healthcare. Very few, it's hard to think of another organization that is as complex or has the diversity of professionals that we have and the interactions. Professionals by their nature enjoy respect, they enjoy autonomy, they have a body of knowledge such that the organization it takes on a very different perspective or complexion. The professionals are not in the normal, to use the legal term, master-servant relationship where you can direct in the way you might direct other employees. In fact, in many healthcare organizations, certain professionals aren't even employees. They're agents, if you will, of the patient. They have a affiliation or an appointment with the healthcare organization as opposed to an employee. So all of which creates a most interesting dynamic. So it's important to understand what we mean by professionals, what are the attributes of professionals, how are they socialized, how do they behave, and when one's working in operations and has to and encounters professionals, how can one work effectively in a relationship that might be distinct from that of other colleagues in the organization. Some things to think about as you, and I'd like you to address this in your journal, but I would like you to explore, well, what do we mean by professional? What are the things that are in place by virtue of statute, by tradition? Can anybody be a professional? Can anybody be a doctor? Can anybody be a nurse? What are the barriers? What are the things you have to do to be a professional? What's society's view on a professional? How does society define a professional? What are the common healthcare professions that we see? Go through in your own mind and think about the myriad that we have. Obviously, doctors and nurses are at the cornerstone, but there's obviously many others. What are the attributes of a professional? In your experience, what have you seen, both potentially as a patient, but also as a colleague? What are some of the attributes that you see, both good and perhaps not so good, that attributes you associate with being a professional? Think about the socialization. Think about how people are attracted to a profession, how they enter, say, university, what type of person is going to do well in university in terms of getting the academic standards to move on into a profession such as nursing or medicine or occupational therapy or physiotherapy, you name it. What happens when the person is in that professional school? What socialization processes take place? Can you imagine or think of some behaviors that are perhaps reinforced, some behaviors that are perhaps attenuated during the professional process, professional education process? What do customers expect or patients expect or clients when they meet with a professional? What kind of behaviors do they expect? Is that in line with the training programs? Are you aware of any innovative training programs that have been designed to address some of the perhaps criticisms that have been made over the years of how professions are trained? What do you see in terms of environmental issues that are out there with respect to how people are expecting to work in the workplace? Do you see more collaboration? Do you see an expectation of people wanting more respect regardless of their title? What do you see in that regard, and how does that impact the working relationships with professionals? What do you think about interprofessional collaboration? There are some readings for your reference that I would encourage you to look at. But look at the theory around what people are saying in terms of the attributes of interprofessional practice. Why is that considered to be a good thing? Why is that appropriate in a complex healthcare environment? What are the benefits? What are the challenges? So do look at that and just think about the dynamics. What are the key ingredients in working in a collaborative practice model? What needs to be done? What are the things, what are the attributes of a shared collaborative practice model? Think about all those things. Power. Who has power in the relationship? Who needs to give power? Who needs to assume power? How does one manage the whole dynamic around power? Who's captain of the ship, so to speak? And how do we manage conflict? Is that an issue? What are the root causes? So I hope that in this brief overview you get a sense of some of the dynamics. Again, I'm not trying to suggest there's a right answer or a wrong answer. I'm just trying to create a bit of a creative, or constructive process to examine a dynamic that exists in healthcare and to look at how one can work better together in the interests of the patient.